Hey
Hello.
there.
There you are.
My goodness. What
I
has
know.
happened?
I don't know. I'm checking to make sure no one on my team was actually on at the same time that we were on. So I think we're clear now. I just told everybody if anybody's on my account, get off. We're trying to have a webinar here. How are you?
I am great. And yourself?
I'm good. I'm good. I'm so glad we were able to connect. I was like, oh no. But it's technology. This stuff happens. So let's jump right in with a proper introduction. Okay. I know there's
Sure,
people,
whatever you want.
they've been messaging and waiting, and we've all been waiting for this topic. So I'm super excited today, you guys, to introduce Dr. Al Danenberg. He's a periodontist in practice for 44 years. He sees patients once a day, 1 day a week at Bluffton Center for Dentistry in Bluffton, South Carolina, and incorporates ancestral nutrition and lifestyle with his leading edge LANAP laser protocol. Can't wait to hear about that, to treat periodontal disease. In 2014, he became a certified functional medicine practitioner and then a certified primal health coach. In 2015, he was appointed to the faculty of the College of Integrative Medicine. This is amazing. I'm getting fumbled because so many people are going to relate to you right here because you're speaking to health coaches today. Dr. L has developed a global presence and has been featured in many podcasts and seminars regarding ancestral nutrition, lifestyle, and overall health. In 2017, Electra Press published his book, Crazy Good Living, which is based on ancestral nutrition and lifestyle. And I am going to share your website as we go through the webinar today, but I just want to welcome you and tell you that this topic is so long overdue for me to bring to health coaches, and I'm so grateful for you to be here.
Thank you. It's a pleasure. It's very exciting to talk with you too.
Yes. So let's start out with you telling us about that, what I just asked you about. Tell us what this creation you've come up with is. Tell us all about it.
You mean how I put all this together and treat periodontal patients at the same time?
Yes, and how I wish I'd found you 10 years ago.
Well, I mean, obviously it starts a long time ago, but I had a stroke at the age of 59, and I figured that I needed to get healthy, and I didn't know what I was doing wrong. I went to the medical communities and tried to figure out what I needed to do, and they had suggestions that were basically American Heart Association, American Diabetic Association, all these ideas of what you need to do to get healthy. Mm-hmm. I followed that until I was maybe 66. And I still weighed about 187 pounds. I was on 7 medicines because of my stroke. And I figured I'm not really getting very far. So I needed to do some more research. And I found a course at the Kripalu Center for Yoga and Health, mm-hmm. which of all places had a integrative nutrition program for healthcare professionals. And it was a 5-day course. And it was all on ancestral nutrition. And ancestral nutrition was a totally foreign phrase to me. I didn't even understand it, but it made sense. And I incorporated that concept of nutrition and lifestyle. And from the age of 66 to the age of 71, which is where I am now, I lost 35 pounds. I eliminated all my medications, and up to 6 weeks ago, I would have told you I was the healthiest 71-year-old guy walking this earth. Right. Now, there has been a little change in my life recently, and I have been diagnosed with an aggressive form of multiple myeloma. Oh my God, here I am, the healthiest guy around. Well, we can talk about that later and what I'm trying to do. And I'm not going the conventional route. I'm doing everything integrative and holistic. But basically, I changed my life by changing nutrition and lifestyle. And my research indicated that it was advantageous for all chronic disease to change this nutrition and lifestyle into an ancestral way of living. Mm-hmm. So I incorporated the concepts in what I do with my periodontal patients. As a matter of fact, I am currently the principal investigator for a double-blind study that I have written and has been approved by the Institutional Review Board to study the effects of improving the microbiome with spore-based probiotics that will enhance the health of the gum tissue. So everything starts in the gut. So if I can make the gut healthy and improve a patient's lifestyle, and incidentally, we'll do certain things in the mouth to get that healthy, we can go a long way, not only in treating gum disease, but in treating all kinds of chronic disease. And that's how I put it all together.
That's amazing. So tell me this, when you first started bringing this idea to your patients, were they like, what are you talking about? What do you mean
Well,
that can affect my gum health?
they still do that. So,
Yeah.
I work in an office only 1 day a week, and I'm really phasing out of that. Soon I won't be even seeing clinical patients. But basically, in a conventional, even though it's a biological dental practice, it's basically conventional dentistry with better materials. Patients just come in and think they have a gum problem, they want to be treated. They have a toothache, they want to be treated. They don't see the relationship. I would say 1 to 4% of my patients, when I really get down to the nitty gritty, and everyone hears my shtick, by the way,
Mm-hmm.
really get down to the nitty gritty, maybe they follow what I'm doing close to 100%. Those that follow it really see an improvement. I even had a patient that literally, I'm seeing him for the first time. It's an examination. I'm telling them, we need to get to the bottom of this problem. We'll treat the mouth, but we need to get to a situation where you don't keep recurring or having recurrence of gum disease.
Mm-hmm.
Theoretically, it can't be cured, but I do believe you can cure that. So I explain nutrition and the effects of the gut and whatever. And the patient left the dental operatory, went to the front desk, and said that they needed to be referred to a real periodontist because they didn't want to be talked about nutrition. They just wanted to have their gum tissues healed. So, there's a mindset, and somebody has to get through that, and everybody has a tipping point before they believe something to be true and they get motivated. But I have had patients that have just been amazed in their overall health as well as their periodontal health by changing their lifestyle and nutrition. But you have to change the mouth too. So the problems really start in the gut, really do start in the gut. But when they start damaging the mouth creates its own unique, independent type of infection that leaks through the gum tissues into the bloodstream, just like the damaged microbiome in the gut affects the systemic circulation. So you have 2 nituses of infection. They both need to be treated. This is a real problem today. Functional medical people that are brilliant and understand, let's say, the gut and how to peel the onion away to figure out what's going on can treat the gut in a very effective way. But they don't know anything about the mouth. Right. So the dentists that are even biologic, they think you just need to kill bacteria, which is totally wrong, by the way. So they just want to kill all this bacteria, put materials in the mouth that are compatible, but they just want to kill all this bacteria, and they don't know anything about the gut. So if you kill either nidus of infection in the gut or in the mouth, you're still allowing the other infectious area to create more chronic inflammation, more chronic disease as time goes by. And it doesn't happen in a week or a month. It could be several years or decades. So you need to treat both. The idea is to bring biological dentistry concepts into functional medicine concepts and integrate the treatment of both nituses of infection. There could be other nituses of infection. You could have an infection, a lung abscess. You could have any mucosal infection that's chronic that will start to pour infectious toxic elements into the bloodstream, creating systemic inflammation that will affect every organ in the system based on the genetic predisposition of that patient.
Right.
So that's where I am.
Yeah. So tell me, I want to ask some really basic dentistry questions.
Sure.
Can we get basic? Okay.
I love it.
So is it true that you may be genetically inclined to have more cavities than anyone else? Is it true that you can be genetically inclined to that?
Well, there is a genetic predilection for periodontal disease.
Okay.
And there could be genetic predisposition for certain metabolic problems. So yes, there is. But the secret is this. Even if you understand the genetic component, even with cancer, if you understand the genetic component, the epigenetic components far outweigh and can suppress the genetic predisposition for the disease.
Right.
So I would say, based on the science that I read, maybe 80% or so of a disease is reactive to the epigenetics, which is the environment
Mm-hmm.
nutrition, and the entire environment, and maybe 10 to 20% genetic.
Okay, I got you. Same. It's always, it always seems to return to that old comment, you know, that genes load the gun and environment pulls the trigger. What are we doing in our world? Yeah, to pull that trigger. Yeah. Okay. So can you tell us what is going on with the mouth microbiome? We're starting to hear about that, the microbiome of the mouth. So can you give us a little bit of you can get geeky on this too, because I think our people will understand.
Sure.
Tell us about that.
Sure. So, everybody wants to get on a bandwagon. So there's a bandwagon, and one of the bandwagons is there's a microbiome in the mouth. Let's kill all the bugs.
Right.
Well, let's start off with saying that dental plaque is healthy until it's not healthy.
Okay.
So dental plaque, that's that film around the tooth gum margin, contains maybe 700 or so microorganisms.
Wow.
It is a biofilm that is a healthy biofilm in the mouth. Let's go back into history for a second. If you look at skeletal remains of jaws from 10,000 years ago to maybe 50, 80,000 years ago, when we have that kind of information, and you look at these jaws, you will see, for the most part, very healthy jaw bone and practically no tooth decay. But you also see a mineralized deposit that is attached to the tooth root at the bone line, and that is calculus. Calculus is calcified dental plaque. So if dental plaque was so unhealthy, then all of these jaw bones with all of this mineralized dental plaque would have serious dental decay and bone disease, but they don't. So the reason is that the dental plaque in your mouth, if you're eating healthy and you don't have all these toxic influences, which is difficult in the world we live, but if you're eating healthy and you're not toxically burdened, then that dental plaque is in a state of symbiosis. Those bacteria of 700 or so, some individually are very virulent, some are not virulent at all. But in its homeostatic state in dental plaque serves a purpose. They produce a variety of types of hydrogen peroxide in combination with one another to kill off other pathogenic bacteria that may want to try to invade the area. They also maintain a pH level, which is basically a neutral, slightly acidic level, to protect the mineralization of the root. And if there is a problem with demineralization of the root, it is the kind of the gatekeeper to allow the nutrients from the saliva to flow into the dental plaque and be distributed to the root surface as needed 24 hours a day, 7 days a week. So if you remove all this dental plaque, you've stripped it naked. It's like walking outside with no clothes on. I mean, there's no protective barrier. So biological dentists, for the most part, unless they understand this, generally want to kill all this bacteria. This is the oral microbiome. Let me tell you another thing that's interesting. There is a microbiome on the top of the tongue. At the base, at the top of the tongue towards the throat, it's made up of many, many anaerobic bacteria. Well, if you're eating very sulfur-containing foods, and this anaerobic bacteria breaks down these sulfur-containing foods and it deposits on the back of your tongue, it creates a bad odor. 80% of mouth odor comes from the top of your tongue towards your throat. So theoretically, if you say, okay, I know this anaerobic bacteria is creating all this bad breath, let's kill this anaerobic bacteria and we will be done with bad breath. So you use antimicrobial mouthwashes and you kill this bacteria and you have a sweet smelling breath. But guess what? This anaerobic bacteria provides a biological function that is critical to the health of the body. And here's what it is. The anaerobic bacteria, when it's in a state of homeostasis, not overgrown, but when it's in a state of homeostasis, takes nitrate, natural nitrates from the saliva. So you've eaten lettuce and you've eaten it, and the nitrates get absorbed into the bloodstream, and 25% gets absorbed into the salivary glands, and it's poured into the saliva. So this biologically active nitrates is acted upon by the anaerobic bacteria, creates nitrite.
Okay.
The nitrites you swallow goes through a variety of biological processes, and much of it is then produced as nitric oxide. Nitric oxide is critical for blood pressure control, for cardiovascular health, as well as even gum disease. It helps prevent gum disease. There was a paper that was written in a cardiology magazine just a couple years ago, and it was really written for cardiologists, and that said, if you are a physician and you're prescribing blood pressure medication for your patients, and you're not getting the result that you think you should be getting, make sure they are not on an antimicrobial mouthwash every day, because it's killing the anaerobic bacteria that is naturally producing nitric oxide, and it will increase blood pressure if you do that.
Wow.
So you don't want to kill this bacteria, but you do want to make it balanced and homeostatic. And you have to start with the gut, but of course you have to understand the nutrition that supports the gut and doesn't feed the bad bacteria in the mouth that overwhelm itself and become unhealthy dental plaque.
Okay, that just opened up like 1,000 different doors for me. I'm serious. I've never heard of that before. I've never heard, and you know, I know we've all come in contact with someone who never has good breath. Their breath is always just, you're like the people that you turn your face away when you talk to them. I mean, I know a couple of people you know, not in my regular life, but every time I see them, I'm like, whoa, what's going on there? So how do you balance, you know, the microbiome? So let me back up. So brushing your teeth multiple times a day, obviously, is a bad idea for the enamel of your teeth, but it's also a bad idea.
No. It's not a bad idea for the enamel of the teeth.
Okay.
But it's unnecessary to brush multiple times a day if you have a healthy microbiome in the gut and you're eating a healthy diet.
Okay.
For example, animals in the wild don't have tooth decay, but they don't have toothbrushes either.
Right.
Our ancient ancestors did not have toothbrushes, and they had healthy teeth.
Right.
Primal societies living in some parts of the world don't brush their teeth with toothbrushes twice a day and floss, and they still have healthy gums and teeth. So it's not the dental plaque or the brushing, but you're not going to damage the enamel if you're brushing correctly. And we can talk about that later.
Okay. So is it, you know, because we have heard that some people can overbrush and they cause gum recession, right? Is that true?
Okay. So that's a great question. If you want to jump into gum recession, I'll talk about that now.
Yep. Let's do it.
Okay. So gum recessions is an interesting fact. The gum tissue around the tooth in a healthy mouth is attached to the bone that is supporting the tooth root in the jaw. So if you have a tooth, think about a screw screwed into a piece of wood. The screw is the root of the tooth. The wood is the jawbone. And now the gum tissue is just beautiful window dressing that attaches to the bone that supports the tooth.
Okay.
So if you scrub the gum tissue hard, you may irritate it and cause the gum to bleed because you're cutting it, but the gum will not recede as long as the bone between the gum and the tooth root is intact.
Okay.
Now, here's the problem. Some people, the bone is tissue paper thin on the cheek side. So some people are born with no bone there or very little bone there. So the gum is just attached to the root, but not sealed tightly to the root. So if you brush aggressively, you could cause the gum that is not attached to bone to recede. That's possible.
Okay.
If you have a habit of gritting and grinding your teeth, you can wiggle the teeth in the bone. And when you wiggle the teeth in the bone starts to melt away, and it will not grow back on the cheek surface of the teeth. And therefore, aggressive brushing after you've been grinding your teeth could cause gum recession. If you have active gum disease, which is creating inflammation in the gum, that infection will melt the bone away and the gum can recede. So if you have healthy gum and you have bone between the gum and the root of the tooth, if you aggressively brush your gum, you won't have recession until the bone breaks down. but you could break the bone down by the methods that I just mentioned.
Okay. So it's not the tissue it's not the gum tissue that we're just, because you get that image in your mind, you know, as a person who doesn't know anything about this, and the dentists are always like, well, you're aggressively brushing your gum tissue away. And you're like, I mean, then you want to just barely brush them. And then you go in there like, well, there's too much plaque on your teeth. You're like, what am I supposed to do? Sonicare, we sell them. You know, that's the solution.
Yes. Yes.
Yeah.
Yes.
Yeah. So that's interesting. I had no idea this had to do with the bone.
It has everything to do with the bone, and it has everything to do with habits like gritting and grinding and infection. Yes.
Okay. Okay. So let's kind of veer away from the recession of the gums for just a second. And actually, we're going to talk. Let me take it a little further. Can you fix the gum recession permanently by doing that graft off the roof of the mouth on top of the gum? Let me ask that. Is it a permanent solution if it has to do with the bone?
So I don't like the word permanent, but it is an effective solution if you have, for example, the gum has receded, it's not attached well, there's infection or root sensitivity, and you have bone on in between the teeth, but not on that chewing surface of the tooth where the gum recession exists, then gum grafting, like you just mentioned, is a very effective method that works very, very well to seal the gum tightly to the root of the tooth, but never like it was sealed to bone because there's no bone there. Okay. So it could be, if you were aggressively brushing that gum tissue, you could break down that gum graft. Now, let me tell you something about gum grafting, and that is, I would say, and I'm going to step on all kinds of professional people here, gum grafting is over treatment planned. There is very little reason to do gum grafting unless the gum that has receded is not attached and it's loose and it's unhealthy, or the root surface is very sensitive. The gum tissue does not support the strength of the tooth. So I know a lot of dentists will say, you have gum recession. If we don't do a gum graft, you're going to lose your tooth.
Really?
That is not a correct statement. If you have gum recession, the gum graft will not strengthen the tooth. Okay. The gum graft will do what I just mentioned, right? But the gum graft will not strengthen the tooth. If you have a weak tooth, maybe your bite is wrong. Maybe you have too much bone loss around the other areas of the tooth root. Habits of grinding and infection are really important to control before you do a gum graft. If you do a gum graft and you're still grinding your teeth and you have active infection in your mouth, that is not a healthy way to treat this particular problem.
It's almost like putting a Band-Aid on it, but you still have the problem underneath it.
Exactly. Exactly.
Yeah. Okay. We've got, so just as an FYI, you guys, reminding you, yes, we have questions in the Q&A. We're going to get to them in a minute. If you have any questions at all, put them there. But I want to ask you what your opinion is on root canals.
Yes. Oh, great question. Very controversial subject. Yes. It's not controversial when you stop and think about certain things. Here's the problem. When you need a root canal, it is because there has been infection inside the nerve of the tooth, and the nerve of the tooth is dying or completely dead, and it's pouring out toxic substances into the environment of the bone structure through little micro tunnels that are around the root going into the bone. Okay. So a root canal ideally effectively removes the infected, abscessed pulpal tissue, nerve tissues that are in the center of the tooth, like a lead in a pencil, that's in the center of the tooth. And ideally, it will eliminate any other spread of infection by sealing it with an inert material, and the tooth can function normally. That's the ideal situation where a root canal could be successful. Here's the problem. The problem is, to actually do a root canal thoroughly, it's a very complicated procedure. A lot of general dentists that do root canals may not have enough experience to do it really well. So I would always consult with an endodontist, which is a dental specialist that only does root canals. So that's one thing. But the other thing is, there is no real way to identify if you've removed all of the very toxic bacteria in these little micro tunnels around the root of the tooth. Because not just the base of the tooth or the apex, it can go laterally on the side of the root of the tooth. So if there is a source of chronic infection and you've sealed that, it can go only in one direction, and that is into the bone, which breaks down the bone, gets into the bloodstream, and affects the entire systemic circulation.
Right.
The other problem is when root canals are done, sometimes there is a crack in the root. Well, cracked roots do not respond to root canal therapy, and sometimes the cracks are very microscopic, they're hard to see, and root canals are done and they fail because this crack continues to allow bacteria to pour into the bone.
Yeah.
For the most part, it probably would be ideal to take that tooth and remove it and put in something that is biocompatible.
Right.
Now the question is, what is biocompatible?
I hope what's in my mouth is, because I'm in the middle of the implant process. Yeah.
Okay, so I don't want to step on your toes, but let me tell you. So implants are fantastic. Most of the implants today are made from titanium or titanium alloy. Titanium is a metal.
Right.
And there is science research that shows that the titanium ions in the implant leaches out of the implant, creates an immune response, and creates a chronic inflammatory response that can affect the rest of your body, and maybe it won't affect it for decades. Right. It can cause damage to the bone around the implant, but it can become systemic too. Okay. There are implant systems that don't use titanium. They use another metal that is very close in the periodic chart to titanium, called zirconium, but zirconium is made into an oxide called zirconia, and it is more biologically compatible.
That's what I've got.
Okay, so good.
Because you told me that. Do you remember me? I messaged you on
Oh, yeah. So zirconia is a healthier implant system.
Yeah. Yay.
So I would definitely go with a zirconia implant. Yeah.
Okay. Yay me. I did something right.
You did something very right. I did.
Yes. I'm in the process of, one reason why I'm excited to have you is because I am in the process of multiple failed root canals after a dentist fractured many of my teeth. And I had no tooth problems whatsoever before I saw the dentist, and many fractures later and failed root canals and pulled teeth. I am in the process of doing the ceramic zirconial implant, ceramic crown with the zirconia implant. It's been a very long process. I've walked around with some crazy stuff going on in my mouth for the last 8-9 months. But I feel really good about my decision after talking to you and messaging with you on Mindshare. So I'm very, very grateful to you for that.
Yeah, and I think you made the right decision.
Yeah, I've got an amazing dentist in Nashville. He teaches the process around the country. So I really,
cool. Very cool.
Yep. Okay. So one of the reasons why you're here with us today, also beyond me asking you, is that we've got someone named Natalia, and she has been really had some anxiety. Now I know she doesn't care for me to share that, around the idea of the things she's got coming up for her own dental health. Okay. Her questions are very relevant for anyone to get answers to. So I'm going to go ahead and go into her, what she calls a question attack.
Absolutely. It says, hopefully I can answer them.
I bet you can. So number one is it necessary to have dental materials compatibility tests done before dental work?
No.
Okay. Yeah. Her holistic dentist says she uses hypoallergenic materials and the test is unnecessary.
I agree.
Okay. That's what I thought too.
For the most part. I mean, a person knows that they are very sensitive, and they're very sensitive to all kinds of elements in our environment, then a biocompatibility test would be applicable. If they've had lots of problems in their mouth and they don't know why they're having problems, and when I say that, they're really aware that their gut is healthy, their diet is healthy, but still they're having problems, biocompatibility testing is good. And there is a test called Clifford, CLIFFORD, which is probably the one of the standards of care for biological material testing.
Okay, great. Number two, is Septicane okay to use as a local anesthetic? If not, which one do you suggest? If treating several teeth in one visit, is it possible to overdose on anesthetic?
Yeah, you can take too much anesthetic for other systemic problems. I mean, it could create all kinds of cardiovascular issues. So you don't want to do that. And the anesthetic generally is combined with epinephrine so that it is controlled in a local environment, and too much epinephrine can create hypertension and a variety of other things. Personally, I use xylocaine, which has been around forever and ever. Septicaine is fine. There are a variety of drugs. Some people react differently with different ones. I'm not really keen on looking at every specific local anesthetic and picking one for this person, one for that person. I have used xylocaine generally throughout my 44 years and have never had a problem with xylocaine.
Okay, great. She says, can a crown be placed on a fractured tooth without doing a root canal? How do I know if the tooth is still healthy enough to do a crown instead of an extraction? Great question.
Well, that is a great question. And unfortunately, she will not know that by herself.
Right.
Generally, if there is a fracture in the tooth and it's only in the crown portion, which is the part of the tooth that you look and see in the mouth, and it does not extend into the root surface, a crown, a cap, could probably be very effective. Okay. If the crack or fracture is actually going into the root and down the root through the bone structure, I would recommend extraction of the tooth and not even play games with it.
Yeah, I agree with that too. Antibiotics after extracting infected root canal. Actually, let me back that. Yeah, let me say sometimes we get given a prescription prior to as well. But she says, I have autoimmunity. I avoid antibiotics like the plague. Is there any way to avoid antibiotics, or is there a natural antibiotic that you would suggest or recommend? Yeah,
of course. Okay. So here's what I do. When I do my surgery, for example, and I do LANAP, which is laser-assisted new attachment procedure, great procedure. It is a surgical procedure, but we don't cut the gum and we don't use any stitches, but it is surgical, it's invasive. And the protocol, you have to be licensed in this procedure. And the protocol is actually to put a patient on amoxicillin for 10 days. So amoxicillin is a broad spectrum antibiotic, and it has its complications, and I don't use that anymore. I do use some herbal products. Unless I have a real active hot infection, I will assist the body to support its own immune system. And I use two products by a company called MetaHerb. I can get it through Standard Process in the United States, which is a company. And I use a product called Andrographis Complex, which is a combination of 3 herbs, Andrographis, Echinacea, and I think holy basil. Those 3 actually do support the immune system and help prevent infection like an antibiotic would hopefully kill bacteria. So I use that. I have the patient starting it about a week before, and they continue it till the bottle is done. That's about 3 to 4 weeks later. And then I use another product called Gotu-Kola Complex, Gotu, Gotu-Kola, Kola Complex. That actually supports healing of the vascular tissues. Because when you do surgery, you're not only looking at the potential spread of infection, you want the vessels to heal. So those 2 products, both of them are made by MetaHerb, are the products that I use routinely. And I don't use antibiotics unless I have to. Now, if I have to use an antibiotic, then I put my patients on a very strict probiotic protocol of spore-based probiotics, not the probiotics that you generally are familiar with. So 95% of the probiotics out there are great bacteria. They do lots of great things in the gut, but the problem is, how do you get it from the capsule into the gut? What happens is, when it's in a capsule or a tablet or whatever, you eat it, you swallow it, it gets into your stomach. The stomach does one very important job, lots of jobs in the stomach. One is to kill bacteria, so it kills it. If you did not have stomach acid that was so acidic, you would die after you breathed your first breath of air and swallowed your first meal, because all the bacteria in the food would get into your body and it probably would overwhelm your body. So the acid in your stomach kills this bacteria for the most part. If the bacteria if these probiotics are not killed in the stomach, then the bile acids will kill them in the upper part of the duodenum. So basically, the probiotics are literally dead bacteria when they get in your gut. But that's okay, because the byproducts of these probiotics are very beneficial to the gut, but they are not redeveloping or colonizing new bacteria. Spore-based probiotics, on the other hand, are resistant to the stomach acid and the bile acids, and they start to bloom in the small intestine and the large intestine, as well as they stimulate new other bacteria to grow. So there's a company called Microbiome Labs that makes a product called Megaspore Biotic, which is a go-to for me. Yep. And I use that with a variety of other probiotic, spore-based probiotics. And I put my patients that are on an antibiotic absolutely on the probiotic right away, and continue with that for another month or so after the antibiotic is done.
That's great. And yeah, and I'm a big promoter and affiliate of Megaspore. I use it every day. I also use their mucosal powder.
That's brand new, and I'm starting to use that myself, as well as if you've tried their prebiotic.
Yep, I've got that too.
Mega prebiotic. Yep. So it's interesting. It's oligosaccharides, which have a sweet taste by themselves, but they aren't irritating to the gut like most fibers. So they do have, this company really is on the cutting edge of improving the gut in many, many dimensions.
I agree.
I like their products.
I agree. I used to do the potato starch for the prebiotics at night, and it used to just be resistant starch. Way too much. Yeah. So I love it. So anyone listening, absolutely look into the Megaspore brand. I use all their products. It's amazing. So, all right. Natalia's asking, do you have suggestions for pre-dental work preparation and post-dental work detox? Like any, we just touched on some of the supplements and things like that, but anything extra that you would throw in for someone that's a little bit wanting to make sure that they're really on top of things?
Well, I think detoxing is another gimmick, gadget type of thing. People think, let's detox, we'll do it twice a year. Oh, wait a minute. You need to detox 24 hours a day, 7 days a week. The way you detox is to eat healthy foods that have lots of leafy greens and whatever sulfur compounds, so that it affects and produces glutathione naturally in your body's cells, and that's the way to produce the detoxifying effects of the liver and everything else that you're trying to enhance. Yeah. So to improve your mouth before a dental procedure, I would make sure that you're eating healthy. Yeah. I would certainly know how to clean your mouth effectively. I have a paper that I talk about how to clean your mouth. It's on my website. Anybody can download it. It's right there. Okay. So it's very simple, but it's brushing, it's cleaning between the teeth with little cleaning devices called TP cleaners and interproximal cleaners, and cleaning the base of your tongue or the top of your tongue with a spoon. You can do a tongue scraper, but a spoon, inverted spoon, is even more efficient and effective, and that removes the overgrown anaerobic bacteria, leaving enough anaerobic bacteria to do its biological processes.
Awesome. Yeah, I'm of the same mind. I'm really tired of hearing about detoxes and cleanses and all of that. I think we're depending way too much on outside sources, not enough on our own body to do what it's supposed to do.
You're absolutely correct.
Yeah. Okay. So what do you recommend for pain? We got about 15 minutes, 20 minutes left.
Are you
guys
there?
have a lot of questions. Yeah. Can you hear me? You hear me okay?
Oh, no.
It's okay. It'll pick back up.
Hello?
Yep. Hold on just a minute. Your signal's red. There you go.
It says something happened to the internet.
Yeah. Hello. Are you good? There you are.
I'm good.
Okay.
So you were talking about detox, and I agree. I think it's an overdone, hackneyed kind of topic right now. I think you should be eating the healthy foods to allow your body to naturally detox.
I agree. Okay. So we've got a lot of questions left. We've only got about 15 to 20 minutes left. So let me go ahead and run through these.
Sure.
Do you have suggestions? Wait a minute. No. What do you recommend for pain after the procedure?
What kind of procedure are we talking about?
We're still on root canals, I believe.
Ooh, okay. So there is a very good amount of research that shows curcumin is a great anti-inflammatory for discomfort. and curcumin is the active ingredient in turmeric.
Right.
But the problem is curcumin is not absorbed well biologically. So MetaHerb, and I keep repeating MetaHerb, but it's a good company out of Australia, just came out with a product called Turmeric Forte, which is turmeric and fenugreek seed, which is like a pepper, that makes it, they say, like, I don't know, 500% more biologically available or something. I'm not exactly sure, but Turmeric Forte is very effective. Okay. Normally, you would take 1 tablet a day. For pain, you could take 2 to 4 tablets, maybe twice a day if you really needed it. Astaxanthin is another product that actually is a highly anti-inflammatory product that is good for pain. Those two really work well, not necessarily in conjunction, but either or. And then you can go to a conventional drug, which is Motrin, Advil, ibuprofen. That is effective. Certainly it's not a narcotic, it's not, but it is a non-steroidal anti-inflammatory, and they have their own complications. But if you're going to use it short term, I have no problem with that either. Okay.
Yeah, and I'll say this too, after going through double extractions, implant placement, I had lots done at one time. I got a lot, of course they give me the pain pills and all that. I think I took a leave for 2 days, and I took CBD oil with a percentage of THC, and I had very little pain.
There you go.
Very little swelling, very little pain, slept really well, and enjoyed my 2 days sitting around with the healing. So,
but the only problem with the CBD and the THC oil, as you know, is it creates a dry mouth.
Well, it was a capsule.
Yeah, but
I didn't have any problem with that.
You didn't have dry mouth after that?
Not at all.
What was the ratio? 1 to 1 or what?
I don't even remember. It was it was a company I've been using for about 1.5 years now. I just bought some extra and had it on hand. I don't even remember the percentage. Sure. Yeah. Okay. No problems though, but it definitely helped with any kind of pain, and my inflammation was very minimal. So
yes, absolutely.
Lucky. Yeah.
No, it's very effective. Yeah. And there's a lot of research with cannabinoids and pain as well as healing. Yeah, absolutely.
Yeah. Okay. Let's see here. I'm going to scoot down to a couple other questions here too. So Andre says, what do you suggest to someone who has extreme gum recession, primarily caused by wearing braces 3 times in life, and more recently due to dental neglect? The sensitivity is so pronounced a person cannot even touch certain teeth with the fingertips. Okay.
So first of all, let's address why there is sensitivity, and let's solve that problem to some extent before rushing into doing gum procedures. Sensitivity is probably the result of maybe the foods that they're eating, and certainly the liquids they're drinking, too much acid in their mouth. That's a very real possibility. So they need to clean up their diet. I do have on my website a 30-day reset, which is basically a paleo type diet, but basically it talks about the foods you can eat liberally, as much as you want, as frequently as you want. There's no concept of counting calories or anything like that. That's not relevant. There's foods that are you can eat in moderation, because if you eat too much, there are issues. And then the foods that you have to resist completely because they are inflammatory. So that's a good start. The other thing is, if that person is drinking soda or even drinking kombucha, which is theoretically healthy, it's very acid. Sauerkraut, theoretically healthy, but very acid. These foods that are very acid are going to continue to irritate the root. So you need to eat foods that are less acid, and you could take maybe a teaspoon of baking soda in water and rinse your mouth out, because baking soda is beautiful because it'll offset and balance out the acid and neutralize it. So that's a great thing. You definitely don't want to brush your teeth for about an hour after you're eating any kind of acidy foods, because the minerals are softer and they can actually be brushed away to some extent on the tooth surface. So you want them to reharden. But that's probably one of the reasons why there's sensitivity. The other reason is that person may be gritting or grinding their teeth. When you grit or grind your teeth, you activate the nerves, and it makes the roots more sensitive. And that person also may have active gum disease, in their mouth in some fashion that is not as obvious to some as others, but that inflammation is very acid and it irritates the root of the teeth. So you need to make sure that the diet is right, get rid of the acidy foods, or certainly neutralize them as soon as you can after you eat them. And if you have active disease, absolutely have to stop that. Once that's the case, then you can consider gum grafting. But there are some other things that you might want to do first. There is a product called MI, the letter M, the letter I, paste, P-A-S-T-E.
I have that at one point.
Yeah, I can't remember the company that makes it. I think it's GC America, but I don't remember. So MI paste. Now, you don't want MI plus. MI plus has fluoride. MI paste is just calcium phosphate and from casein, and it actually helps to harden the root and decrease sensitivity. But here's another interesting thing. There was a study done maybe 4 or 5 years ago that wanted to compare MI paste to another more natural product to decrease root sensitivity, and they were effective in doing that. And what they did was took milk. Milk has calcium and phosphate. So they took milk. I think they used skim milk, but I certainly would use whole, organic, if you could, raw milk.
Right.
And it recommends it at room temperature. Take a little bit, swish it in your mouth for a few minutes, and do that 4 or 5 times a day for several weeks. And actually, the study shows that it will decrease sensitivity significantly because of the calcium and phosphate that is deposited on the root of the tooth. You might want to try that.
Yeah.
Either MI paste or raw milk.
Very cool. Okay. Yeah. Is there any research that's there? We've been hearing about gum tissues being grown with stem cells. Is there any validity to that?
Well, I'm sure it's in the research idea. There is research even to grow a new tooth. That's not been done yet, by the way. I'm not sure why everybody thinks that it's been done. And stem cells have their benefits, and then there's a lot of failures too. So I would like the idea of more research, but if you want me to tell you that it's available today, it's not. And if people are telling you that they can do it, all the power to them. I don't know how they're doing it though.
Right. Okay. Cheryl is asking, what would you suggest for someone who after teeth pulled, a hole in a gum never closed, and food continued to enter into the sinus cavity? Oh my goodness.
Oh, okay. So that's a serious problem.
Yeah. She said she even had 3 grafts, and it's still not fixed after 1.5 years.
Okay. So it wasn't done properly. When what's happened is the epithelium of the gum tissue has grown into the hole, and it has actually lined the cavity, so that now a surgical procedure that needs to be done would be this may be a little gross, but what would have to be done is the area would have to be surgically opened. All the epithelium that grew down into that cavity needs to be enucleated, removed, curetted out, and bone grafting and or other collagen material placed in the area, sealed with some kind of a graft covering.
Okay.
It's a surgical procedure. I would only have an oral surgeon do it, not a general dentist.
Yeah, absolutely.
And most oral surgeons know how to do that. But if it's going into the, I think you said the sinus cavity.
Yep.
So there's some potential spread of infection that could occur. So that needs to be addressed.
Yeah, absolutely. ASAP. That even freaks me out to read that. I know. I'm a freak about my mouth after what happened to me, so I get it, and I feel for you, Cheryl. Okay. Have you ever suggested pH testing of saliva for patients?
Well, no, I haven't tested it. I think it's important not to have an acid mouth, but why do 1 million tests when you can take some baking soda and swish it in your mouth? And I will tell you it's okay. I mean, it's going to be okay.
Yeah. Yeah.
Eat a healthier diet and you'll have a healthier pH level.
Yeah. I think there's a lot of weight put on testing and labs and all of those things, but we're really not even focused on the basic things that we can get in our own kitchen these days.
I agree. And a lot of these labs, not only are they expensive, they have false negatives and false positives.
Yeah.
So you can't always rely on the lab test to be a definitive answer.
Yeah, I agree. Okay, I will need 2 upper jaw extractions of abscess root canals. I've heard horror stories about dentists accidentally scratching the ocular nerves and the person going blind. Is
I've
there
never heard that from an
okay,
extraction, but
yeah,
certainly if you have an infection that is spreading deep into the bone structure, you know that the cranial tissues are not so far from the roots of the teeth,
yeah,
and that could be a problem.
yeah. Okay. She said, I found a U.S. trained holistic dentist in Mexico I plan on working with. Prices are much cheaper than in the U.S. What is your opinion on dental tourism? I love that question because I hear it a lot. Why didn't you go to Mexico? And I'm like, because if I have a complication, I want to drive 45 minutes down the road and get it fixed. That's my reason for not going outside of the United States.
I have no way of telling you the competency of dentists in the United States. Certainly, I can't tell you the competency of dentistry in foreign countries.
Yeah.
I do know that biological dentists are at least aware of more biologically compatible materials. They're more aware of the interactions of the entire body with the mouth and how the mouth relates to the rest of the body.
Mm-hmm.
So I would lean towards looking for a biological dentist, but I can't tell you that it's better to go to a foreign country. I don't know that that's true or not.
Yeah. Okay. Are there any, this is a good question too, because dang, have I been looking for one? Are there any non-toxic teeth whitening methods suitable for very sensitive teeth?
Yeah.
Okay. What are they?
So,
Besides, coconut
okay,
oil?
well, it depends on what you're talking about white. A lot of people want their teeth whitened to a color that is totally unnatural.
Yeah.
So when you see people smiling and it looks like chiclets, if you remember chiclets from way back,
Yes.
that's not natural. That's not beautiful.
No.
A Hollywood smile is not a natural smile. If that's
Right.
what you want, that's fine. And there are ways to do that, but you have to use peroxide and all kinds of stuff.
Mm-hmm.
But how do you get natural stains off of a teeth? Well, baking soda is great.
Mm-hmm.
So you take baking soda and mix it with some just water, filtered water, in a paste. It could be abrasive. You have to be careful. Just put it on the actual surface of the tooth that you're looking at. That's the cheek side of the tooth that you want to try to whiten, and scrub it. You can use a Sonicare. You can use an Oral-B toothbrush and brush it in really good. And that will start to whiten it, and do it several times a day for several days. You don't want to do scrubbing of concentrated baking soda at the gum line because it'll be irritating. So that's a good thing. There's another fruit that works, and that is strawberries. Strawberries have malic acid. Malic acid does help to, it kind of bleaches the tooth to some extent. So you could use that. So you can take strawberry and mash it up. You can take strawberry with a little bit of baking soda and water. Mash it up. It'll look ugly, but use that on the surface of the tooth. And this is temporary. You want to do that on a temporary basis.
Right.
Now, let me tell you some interesting things about normal peroxide whitening strips and things like that. Peroxide has been used for years to whiten teeth, and it does whiten teeth. And it makes them a little more brittle, but eventually within a day or so, that chemistry changes, and that's not a big deal. But when patients go to a dental office and they get their teeth whitened with a variety of techniques, that's one operation that's okay. But then they get these trays that they take home, and they have this very concentrated peroxide that they can put in the trays, and they do it every night because they want these pearly white teeth. They'll do it forever. Well, there was a study that was published not too long ago that was the first study to evaluate what's happening with this peroxide in the mouth. So they actually took, I don't know, 15, 20 people. They used this concentrated peroxide in mouth trays, and the patients wore it for, I don't know, 5, 6 hours a day. And they did it for maybe 10 days straight. I'm not sure that's correct, but something like that. But they also did some blood tests to determine oxidative stress. And they found that when these patients were using the peroxide over the 10-day period, those that were using the peroxide had significant increases of systemic oxidative stress that resembled the oxidative stress that a person had after a heart attack.
Wow.
So what does that mean? Well, the peroxide is an unhealthy chemical. in the bloodstream that either gets into the bloodstream because it goes into the gum tissues and gets into the bloodstream there as it leaks from the tray, or inadvertently you swallow some of it, gets into the gut, and then the gut allows it to get into the bloodstream through the membrane, the actual epithelial lining of the gut. So that creates an oxidative stress reaction, which is a precursor to chronic inflammation in the body. So I'm not opposed to whitening in the office. And I'm not opposed to using trays occasionally. But if you use peroxide trays on a regular basis a long time, you will have the risk of creating oxidative stress, which will create potentially chronic inflammation, which can create other issues years later.
Okay. Yeah, I use a dental food grade hydrogen peroxide spray. It's that one with I wish I could remember the name, but it's got this little blue letters on it, but I use that, and I use a rinse like that. But it's biological, it's non-GMO, it's organic, and it has food grade hydrogen peroxide.
But you don't want to do it every day.
No, I don't do it every day.
That every day. Okay.
No, it's usually just on a Saturday. I do kind of a 5-day thing apart, and then I take a honeymoon for a month off of everything I do.
Okay.
Yeah. Okay. Let's see here. Let's go down. We've got about 2 more questions, you guys, because we've got to go ahead and get wrapped up here. Which foods should be avoided in severe periodontitis cases?
Well, definitely sugars. So free sugars are the killer. And grains are a problem because grains affect the gut microbiome. Grains also have phytates. Most of them still have phytates. Phytates can absorb minerals in the food and in the saliva when you're eating them, and it attaches to these minerals and it pulls them out of the body. That is why I do not recommend, I'm going to step on a lot of toes here, I do not recommend activated charcoal, and I do not recommend bentonite clay
on a
regular basis.
Okay.
Because those are binders. Yes. They are very effective in binding to a lot of different things and pulling it out of the body if you're sick.
Right.
But it also binds to metals, minerals, and it will take away the natural necessary minerals in your saliva or what you're eating with it that will literally come out of your body, or be excreted. So there's no reason to use any fancy toothpaste. You can brush your teeth with water and do as good of a job as anything else because you're just removing soft, unhealthy, overgrown dental plaque.
Okay.
If you want to improve that cleaning method, I would take the toothbrush, dip it in a little coconut oil, and then dip it in some baking soda and just brush with that.
Right. Good suggestion. Okay, so tell us about the LANAP. Tell us about that process, the procedure. Are you the only one in the world that does it?
No. LANAP is a worldwide procedure today, has lots of research, and it's the only FDA cleared laser protocol that not only kills the bacteria that cause the gum disease, but it also stimulates new bone by stimulating your own stem cells in your jawbone. Fascinating stuff. So LANAP stands for Laser Assisted New Attachment Procedure. You could go to their website. It's lanap.com, LANAP.com. Millennium Dental Technologies is the company that makes the laser machine and creates the educational curriculum where you have to get licensed to do the procedure. About a year and a half of study. So what it does is this. If you have active gum disease that has spread to periodontitis, which is bone disease in the jawbone around the roots of the teeth, traditionally a periodontist would cut open the gum, treat the bone damage, maybe do bone grafting, put a variety of medicaments in. They would close the gum with some little stitches. You as a patient would suffer with the healing. There would be swelling, bleeding, discomfort, and it could last 4 to 6 weeks, getting better every week. That's one method, and the best result is just mediocre in my way of thinking. And that's what I used to do for 35 years. So 7 years ago, I was licensed for the Lanapp procedure. Excuse me. And the procedure is surgery, but not invasive surgery. There is no cutting with the scalpel. There's no stitches. What is done is a little fiber optic tip that's the size of maybe 3 human hairs. So it's very, very tiny. You're numb, so you don't feel anything. It's placed between the gum and the tooth. And the light that is used for this laser machine flashes about 20 times a second. And that light has a wavelength that literally destroys a very specific bacteria called P. gingivalis, which is very virulent and active in periodontitis. So it kills that bacteria very quickly, but it doesn't harm healthy gum cells or healthy bone cells. So that laser light only is damaging this particular bacterium. Interestingly, the light itself stimulates mitochondria in cells that can differentiate into new bone, new fibers that attach the root to the tooth, and new cementum, which are the cells of the surface of the root in the bone. So it literally creates a new structure of bone regeneration. So you can actually create new bone without doing bone grafting. And there's limits to how much you can do, but it is an extremely effective procedure. And here's what's beautiful. The next day, patients go about their normal routine. They don't have the swelling or bleeding or the pain. None of that is really there. Some patients have discomfort. Yeah, of course. But far majority of patients walk away the next day doing what they normally would do. And they couldn't do it if they had traditional surgery.
That's amazing. So is it a one-time treatment, or do you have to go back multiple times?
No. It's a one-time treatment. Well, we do half a mouth on one appointment, half a mouth at the other appointment. And then there's follow-up appointments. But once you do that, and once you get into a healthy routine, then you could prevent this disease from coming back.
That's amazing. That's an unbelievable. I've never heard of that before, ever. I mean, that's
so if a person wants to find a practitioner that does it, they can go to that website, Lanapp.com. And I think on the navigation bar, it says something for patients to find a practitioner. You just put your zip code in, and they will get back to you with the practitioners in your area that are licensed to do the procedure.
Awesome. That's awesome. This has been amazing. Not only for like me personally, because of all this stuff that I've been through with my mouth, and just really makes me feel much more relaxed about the path that I'm on with implants. I've got a couple more I'm going to do. I'm about 26,000 in on the implant procedures right now.
Wow.
But if you put, if you think about it, and you put the root canals, the crowns, the pulled teeth, the things that failed prior, it makes more sense just to get the tooth out for $250 and focus on an implant that's going to last for years and years and years with, minimal problems. So
correct.
Yeah, that's my new path. If I ever have any further teeth problems or anything like that, I'm no longer going to be going root canal and crown and all of those. I'm just going to have it pulled out. I don't care. I'm going to do the right thing the first time.
Yeah, of course, prevention is great. So if you have a healthy diet and a healthy lifestyle, and
a dentist that doesn't break your teeth.
True.
Yes.
True.
That's how this all started. But this has been fascinating. So much appreciation for you. And we'll be visiting your website. I bet you're going to get quite a bit of activity over the next couple of days as we share this in the curriculum of the school and with our 11,000 people on our list. And
well, let me just mention one thing. I write quite a lot, so I have maybe 300 plus articles that I've written on my website.
Wow.
If anybody is interested, they can send me an email. It's al@drdanenberg.com. So it's al@drdanenberg.com.
Okay.
And if there's a subject that they are interested in, and if I've written something about it, I'll just send you the link or them the link to an article or two that I've written. But you can check the website. There's all kinds of stuff. You can download all these articles. Not a problem.
Awesome.
And read my book.
Yes.
You got to read my book.
And get the book. So we're going to go to your website, and we've got the email. All of that's in the chat, you guys. So
and I do consults on Skype too. So if anybody really want a one-on-one, like you and I are doing right now, I would do. And I've done Skype consults as far away as Australia. So there are a lot of people that just want more information or an idea of how to navigate what they're trying to do. We can do that. They can send me their dental x-rays. I had them fill out a 3-day food journal. as well as a questionnaire so I can get into their nutrition and understand where they are in their dental and medical problems.
Okay, Natalia, I think that's a great idea for you to get to really help you to calm those anxieties as you go into this process, because it doesn't have to be that nerve-wracking, and there doesn't have to be all this anxiety around if you have all the good information on the front end. So thank you so much again, and best of luck in your journey with your cancer, and the prayers will be abounding for you, and we just appreciate you. And
it's a pleasure. And again, I am fighting this non-conventionally. So no chemotherapy for me. It's strictly pulse electromagnetic field therapy, which is quite exciting. Cannabis, quite exciting, as well as a million supplements that my integrative physician is suggesting I take. So
I know you feel good about it.
Yeah, I feel good, and I feel good about it.
Awesome. Well, we'll be watching your progress, and thank you again. Thanks everyone for joining us. Have a wonderful, wonderful weekend. Thank you so much.
Thank you. Take care. Have a great day.
You too. Bye-bye.